Many couples have already been seen by our specialist colleagues in the community and already know they have a diagnosis of conditions such as endometriosis, polycystic ovarian syndrome or blocked fallopian tubes. All of these diagnoses are quite common, and our treatment staff are able to provide a variety of treatment options to cope with all of these scenarios. At Repromed, we're able to offer a number of different tests to help you decide when and if you wish to start fertility treatment. Whilst there are a number of different treatment options, most couples choose IVF because of its much higher success rates. IVF involves collecting eggs and sperm and creating embryos to replace into the womb. With modern treatment regimes and the newer generation drugs, IVF is very effective, safe and has a low level of side effects. Our patient coordinators and fertility care staff can help you discuss these options before your initial visit. What happens during a typical IVF treatment cycle? On day 1, which is the first day of the patient's menstrual period, patients phone to book on for treatment. On day 2 or 3, the woman will start taking injections which typically last for about 14 days. During those 14 days, we'll ask you to come for blood tests and scans on 2 occasions. These can be done very early in the morning so they don't disrupt your normal working day. When the eggs are ready to collect, which is usually about day 14 of the cycle, you'll visit Repromed, go to our operating theatre, and the eggs will be harvested through the vagina. This is a very quick procedure, but you will be with us for most of the morning. We then mix the eggs and sperm in our laboratory to create embryos. Embryos are usually replaced into the womb on day 4 or day 5 after egg collection. Again, this is a quick procedure, only taking 15 minutes. All of these treatments have very low levels of side effects due to the modern medications that are used. After the embryo is replaced is probably the hardest part of an IVF cycle, where patients have to wait for 2 weeks to see whether they have a positive pregnancy test. About 50% of patients will have a positive pregnancy test, but sadly the other half will be unsuccessful on this occasion. After a positive pregnancy test, we'll arrange for you to have a pregnancy scan at around 6 weeks, and if this shows that the pregnancy is normal, we'll then refer you on to an obstetrician for ongoing care for the rest of your pregnancy. The vast majority of patients use their own eggs and own sperm to create embryos. However, certain medical conditions mean that donor eggs or donor sperm have to be used. Repromed is able to offer those fertility treatment options.